Hi everyone, and welcome to our Michigan Medicine live event. I'm Ed Bottomley with the Michigan Medicine Department of Communication, and today's topic is LASIK. I'm joined by our three guests. In the middle, we have Dr. Christopher Hood, a cornea specialist at Kellogg Eye Center, where he performs refractive surgery and evaluates and treats cataracts, dry eye, and corneal infections and other conditions of the cornea. We also have next to me, Erin Mano, the lead technician in the Cornea Refractive Surgery Department at Kellogg Eye Center. And on the far end, we have a patient. Welcome, Andrea. Andrea, you had LASIK surgery, and you'll be able to speak more about the actual patient experience too. So before we jump in with the questions, just a quick reminder for everybody watching today. You can submit questions at any time, even now, for our panelists to answer during the Q and A portion of today's chat. Questions can be submitted in a couple of ways. You can comment on this video, but please note that your name or your profile name will be visible to others participating. Now, if you prefer a more anonymous option, you can also send a private message to us via Facebook. If you can't stay for the entirety of the chat, or if you want to share this recording with a friend, a video of the chat will be available on the Facebook page soon after, and we'll also be posting to the Michigan Medicine YouTube channel too. So let's move on to our questions. We want to answer questions today about refractive surgery. What are we describing when we say refractive surgery?
Yeah, I can take that one. So refractive surgery, it basically means correcting some need for glasses. And there's different types of refractive surgery that we do. So that encompasses LASIK, which is what most people think of when they think of refractive surgery. And then also PRK, or LASEK, is another name that it could go by. Very similar procedure, PRK and LASEK, which we can get into later if it's important. And so basically correcting the eye's need for glasses is what we mean by refractive surgery.
Excellent. Who performs LASIK at Kellogg?
I can let Erin answer that.
So only our cornea specialists do refractive surgery at Kellogg. So we have Dr. Hood, who sees patients at Ann Arbor site, and he also will see patients at Grand Blanc. One of our other physicians will go to Brighton at our Brighton office, and we have one in Northville as well. But only our cornea specialists, which is that we emphasize for our patients.
And these are board certified?
They are cornea fellowship trained.
Excellent, excellent. Let's talk about the evaluation process before someone goes into this. What happens during that evaluation process to determine if someone's a good candidate for LASIK? What do you guys look for?
Well, I'll let Erin answer that again because she's, as our lead technician, really has a lot of these screening evaluations, as we call them.
So on our end, what we do is we tell our patients they're going to be with us technician-wise for at least an hour before they see the physician. We do their history, we check them for any type of prescription change. We also do special topographies that the physician will review in the room with the patients to see if there's anything that would eliminate them from being a candidate for surgery. We tell them it's one of the most thorough eye exams they will ever have.
That is a common response, is
Yes.
that it is, most people say, most patients, that it is the most thorough eye exam they've had. They're oftentimes with us for several hours between the testing and speaking with the physician. And we're looking at a number of different factors to see if someone's a candidate. Stability of prescription is obviously very important, but then discussing other risk factors that they may have for refractive surgery, such as any evidence of dry eye or other corneal conditions. And then making sure that the cornea shape is very normal, that we expect a good response. And then talking about expectations in terms of the vision need and the recovery. So that's all the things we do in our screening visit with patients.
Great, and Andrea, that's presumably something that you would have been through.
I did go through it. It was fine. A lot of tests, obviously, I wasn't familiar with, but it was, I'd say, about an hour long and pretty easy, pretty simple. Look here, look that way, look into this. So pretty straightforward.
Excellent, excellent. How long does the procedure itself take place? And is it done in an operating room?
Yeah, great question. So we actually have a LASIK procedure room, refractive surgery room that we basically have in our cornea clinic. So it's a sterile room where we do the procedure. So it's not a separate operating room in a separate building. We do it right at the Kellogg Eye Center. The actual procedure, I tell people they'll be back there for about half an hour ballpark. But the actual lasering for most patients is only a brief portion of that. And again, Andrea could probably speak to that, but most of the experience is getting set up, is basically getting the eye clean, getting the patient ready for surgery, positioned properly in the actual procedure room. The lasering is usually a very brief part of that, typically under a minute of total laser time for most patients.
Interesting. Andrea, I see you nodding over there.
Yeah, I was shocked by how quickly the actual procedure was, like being in and out. Going back there, it took moments. My dad took me, and I came back out shortly after, and he was like, shocked. He's like, I thought this was going to take way longer. So, yeah.
Their initial screening evaluation is longer than the surgery itself.
Yeah.
Interesting, very interesting. So let's talk about, what do you consider a successful surgery?
Yeah, so from the physician's perspective, I really want to make patients happy. And so my definition of success would be, is the patient happy with the outcome? And I think that's where it's very important during that screening visit with the patient to really establish appropriate expectations. Patients that have a much, much higher prescription may not have the same expectations, and we may not expect the same result as someone who has a small prescription that may be more successfully treated by LASIK or refractive surgery. But ultimately, it's going to come down to, is the patient happy with their outcome? And so I think it's a matter of asking the patient what they expect to get from the surgery and making sure we can sort of meet that need. And if we can, then that's the goal.
Great. And then this kind of ties into that one in terms of the flip side of that. Can you comment on what complications may occur?
So there's any number of complications. It's a real surgery, and there's certainly risk to every surgery, which again is, I think, why it's important to speak with the patient and have the physician go over some of the specific risks that a patient may have over another patient, whether they have a very high prescription or they have maybe some dry eye that may make them more prone to having symptoms of dry eye after the procedure. But there are many things. Luckily, all of them are pretty much very uncommon. When you add them all up, they still are a very small percentage of patients. But some things, like, for example, dry eye, which I've mentioned several times, is something that happens to many people. In fact, it's almost expected to happen in the short term for most patients after refractive surgery. Now, almost for all patients, it will go away within a few months. And so we counsel them beforehand that dry eye is very common, and you will likely need to use some artificial tears to lubricate the eye. But then after a few months, for most patients that aren't at high risk, it should resolve and go back to how it was before they had surgery. But there's a number of other risks that could occur, and we go over those specifically with patients.
Great. And Andrea, I saw you nodding again with the...
Yeah, the dry eye for me was definitely a few months after the procedure. Something I just wasn't really familiar with, but definitely was given the heads up that could be a side effect. And after a few months went away, it started going away in the wintertime sometimes if it's really dry. I also sleep with a fan on. There's certain things that in the morning can be dry, but for the most part, I don't have anywhere near the kind of dry eyes that maybe I might have had the first month or two.
Great. We have a little bit of a long question here. Is it true that if you wear contact lenses, you must not wear them 1 week prior to an evaluation? Is that true? Also, if you're a candidate, what is the appointment wait time before a procedure can be done? So a couple of questions in there.
I'll let Erin take that one.
So it is true, you need to be out of contact lenses prior to the initial evaluation. We ask patients when we're screening them on the phone if they wear rigid gas perms or hard lenses versus soft. At Kellogg, we have them be out of contact lenses if they're soft for a full week. Rigid gas perms, 3 weeks before. And I'm sorry, what was the second?
And the second part, if you're a candidate, what is the appointment wait time before a procedure can be done?
Typically, we can, once we see the patient, we can get them within the few weeks from their initial evaluation. And we do our screenings Monday through Friday with all of our physicians.
To dovetail on that, if they can.
Sure.
The reason we want patients out of contact lenses is contact lenses can warp the shape of the cornea, and we want to basically get the cornea in its natural state when we're planning surgery. We want to be able to treat the eye not as it's in a warped state, but in a normal, back to its baseline state. So that's why we want patients out. There are times when we actually will see some irregularities in the cornea shape and actually request patients to stay out for even longer periods of time and come back for some remeasurements to make sure things have returned to normal. We just want to give patients the best outcome, and we think that's the best way, one of the ways to do that.
Thank you for clarifying that. What are some of the reasons somebody would be considered a poor candidate?
Yeah, there's a number of reasons. One reason is that people could have prescriptions that are just too high to treat. The lasers do have limits, and there's a safe limit of what can safely be treated, because we're basically reshaping the cornea in these refractive surgery procedures. And so the lasers really have limits of what they can do. So that's one reason people may not be a candidate. Another reason is that people could have other eye diseases that make them not a good candidate. They could have cataracts or other eye disease that would make them not suitable for refractive surgery. Another one is that they have an irregular shape of their cornea. And so that's, again, what we're looking for largely with the screening testing is, are there irregular shape of the cornea? That could lead to a potentially very bad outcome. And so we really want to make sure we don't miss people that would have that, because, again, we want to give patients the best outcome we can.
Sure, absolutely, absolutely. So one of the beautiful things about the Facebook Live is, we can take live questions, and we have people watching right now. What would you say to them? What is the first step, timeline included, if you're interested in having a procedure?
Again, I'll punt to Erin on that.
So you'll need to have an initial evaluation with one of our physicians at Kellogg. And again, it depends if you wear contact lenses. There are certain things when they call in, we ask them, example is women, we ask them if they're nursing or pregnant, because we will not do an initial evaluation on them until they are at a certain time point. But it's actually, once we get them in, it's not long at all if they are a candidate that we can schedule them. And our evaluations are good up to 6 months.
Okay,
so they'll
great.
have their evaluation, and then up to 6 months they can call and schedule. Outside of that, our physicians require them to come back and have another screening.
Sure, sure.
And I'd also emphasize that on the day of the screening evaluation, you will actually meet your surgeon if you come to the Kellogg Eye Center, the one who would be performing surgery on you, so we make sure all your questions are answered, that, again, expectations are quite clear of what the goals are of surgery. And then typically the next time you see any of us would be for the return for the surgery, which, again, was usually within a few weeks at the most of the initial screening visit. But it's patient preference. Some prefer to wait based on their schedule, and there's no problem with waiting, but many people come in when they're ready to go, and they want to have it as soon as they can.
Sure,
And
sure.
we have great continuity, in which we tell them on the phone when they call into our office. So the physician that they see, if they're a candidate, will be the one, in most cases, doing their surgery and their follow-up care. So that way the patient knows that they see the same surgeon.
That's great too. That's
throughout.
great too. We mentioned pregnant women in the previous question. I've heard speculation that women should opt for LASIK after their childbearing years, as vision can worsen during pregnancies. Is this true or false?
So it can change during pregnancy, likely due to the hormonal influences that are occurring during pregnancy and breastfeeding as well. And so we don't have to necessarily defer all surgery until after childbearing years, but we don't want to have someone who's actively pregnant or breastfeeding to undergo a screening evaluation and then surgery, because that could be a slightly different state of the eye. So there are many young women who have surgery and they get great outcomes. The vision could fluctuate if they do later get pregnant or breastfeed, but it should return back to how it was in most cases before that state.
So, next question. Athletes like LeBron James, like skier Lindsey Vonn, they've opted for LASIK. What advantages can it provide for athletes?
Well, maybe we can ask Andrea. I don't know if you're involved in any athletic things, but...
I mean, I used to play tennis, and I think, I wore contacts more than I did glasses, so I'd say for anyone that wore glasses, that's obviously huge. But as far as contacts go, there's so many issues that can happen. You know, if dust, you get hit, anything, it can, jumping in the water sometimes can like flood it and push it back. So I think just being able to see with the eyes that you're given is a pretty big advantage.
Yeah, I'm interested, beyond the athletic advantages, just your day-to-day must have changed quite dramatically.
It did, and what I was most surprised is how quickly I got used to it. From wearing contacts, taking them out every single morning, or putting them in every morning, taking them out every night, every single day. It's just such a routine that I was just so used to. And then after the surgery, I woke up and you can see, and I just got so used to like, oh, I don't have to pack my glasses, some solution, my contacts. Like it literally just went right out my head that I can wake up and see, and the routine was gone completely. So
That's great.
I can say we get a lot of patients who say, I still do reach for my glasses right when I wake up on the nightstand. I'm so used to doing that. Oftentimes they say it's just amazing that they don't have to do that anymore. They can just wake up and be able to see right away.
Yeah. And then back to the question itself. I'm sure it does. There are obvious advantages if you're talking about someone like LeBron James or Lindsey Vonn or anyone in that professional sphere for having LASIK. The advantages must be obvious. So I'm a soccer fan. I know a couple of goalkeepers who've had it done, and that too.
Yeah, I think as long as the expectations are clear, then I think that it can be a great surgery for athletes as well. Yeah.
So on to the next question. How many years of stable prescription do you recommend prior to proceeding with LASIK?
Do we ask them that, Erin, in the screening when they come?
Yes, and most of the time they'll say at least 2 to 3 years it's been stable.
Mm-hmm.
If it's fluctuating a lot, then obviously they'll have the discussion with the physician, but if it's still continuing to fluctuate, that's when they step in and have the conversation of whether they're a candidate or not.
Great.
But we do like them to be stable.
Sure,
yeah, they do need
sure.
to, because we're treating one prescription, and we don't want to have to go back and keep doing enhancement or touch-up procedures. And so we look for stability, and most of the time patients will have an old glasses prescription, oftentimes from several years ago. We compare that to the current prescription that we check, which we do check multiple ways actually when they come in for their screening visit. With the eyes undilated and then dilated, which gives us actually some more information about the natural state of the eye. And then we often have to look back at their glasses prescription or old contact lenses and make sure that's stable. But by and large, most people over the age of 21, which is our minimum cutoff for surgery, do have relative stability in their prescription. And so age alone, for most people that have an otherwise normal eye, will lead to stability for the most part.
Excellent. And Dr. Hood, you kind of anticipated my next question with regards to age. Is there an ideal age to have the procedure done? Did you say that the youngest age is 21?
21 is our minimum age. There are some practices that will treat patients younger than that if they've got proven stability in their prescription. But in terms of the ideal age, it really is going to be about the patient. We get patients in their 30s commonly. Oftentimes when people start to have problems with contact lenses because of just contact lens wear every day, it starts to wear out people, and they start to say, they have symptoms with their contacts and they want to, get rid of them if possible. But whenever we see patients that are young, to me, I think it's great when people that are young come in because they have potentially much longer to enjoy their glasses-free vision in many cases.
Sure, that's an excellent point. Is there an upper limit or maximum age for LASIK?
Do we ask them on the phone?
Patients will call in and ask them that, and we tell them there is not a cutoff age. But that's where their previous history or eye history or health comes into play, if they have cataracts, all of those things. But we do not tell them they cannot have a screen at any age.
Yeah, there really isn't an age limit in terms of what we can do it on. In fact, Erin mentions cataracts. Cataracts are very common when people get older in their 60s and 70s, and sometimes younger than that. But people that have even had cataract surgery and still have a need for glasses can still be candidates for LASIK or refractive surgery. So we can actually do refractive surgery on patients who have already had cataract surgery, typically for small errors of glasses, small need for glasses in those cases. But we can do it up till upper ages. I'm not sure what the oldest we've treated is, but
In 70s.
yeah, we may have treated people in their 70s.
Okay, so here's a question, a great follow-up question about aging and vision. Will all adults eventually need reading glasses as they age? Can LASIK help me get rid of reading glasses?
Yeah, so we're laughing because it's a very common question, and actually, unfortunately, not a very simple answer when you start to get into the nuts and bolts of it. So the simple answer is yes, everyone will need reading glasses that has good distance vision once they get into their typically early to mid 40s. And that's because of a different process in the eye where the lens of the eye becomes less flexible, less able to sort of zoom in, which we take for granted when we're in our younger years. And so a stiffening of the lens of the eye basically prevents the eye from giving you really good near vision. And it's a progressive process that is symptomatic for most people in their 40s, but continues to decline until you're in your 60s. Again, people that have good distance vision. Now, some people are naturally nearsighted, and they already can see up close, and so without glasses. And so this is where it becomes a little bit more confusing, and it's oftentimes best to have a conversation with the patient about their specific situation. It'd be impossible here to get into all the details of each situation. LASIK does not affect the status of the lens, which again is what's losing its flexibility to give you the zooming power. So LASIK itself cannot directly treat the need for reading glasses. Now, the most common workaround we have for that is what we call monovision, where basically one eye would be targeted to be a near vision eye. The other eye typically would be a distance vision eye. And in that situation, some people can be very functionally free of glasses at distance as well as near, as long as the expectations are clear, because it's a different situation to only have one eye for each distance.
So the next question, how do you know if monovision will work? Is it a problem to have one eye for distance and one for reading?
I'll let Erin answer.
Sure. We actually, and when we do the evaluation for the physician, we typically will have this conversation and we demonstrate it for them in the room in what we call a trial frame.
Great.
But we also tell patients that our physicians will, if it's something they're interested in, have them trial it in contact lenses first. We want them to, and we tell them we want them to do their work, their everyday living, their hobbies, to see if they can in fact adjust. With monovision, some of the feedback from patients that we get, the near eye, sometimes they will feel that it cuts their peripheral vision off, or they feel like they're swimming a little bit. So they may want it, but they just can't adjust. And that's why they will have them trial it first, because it's not something that the physicians will do automatically without getting further into detail.
Sure.
Yeah, I would just emphasize that for the right patient, it can be a great solution. We have many patients that are very happy with monovision, but many patients don't tolerate it and never would. And so we don't want to ever do that treatment surgically, because it's very difficult to reverse these things. And so we really want to make sure they're comfortable and that's the right choice for them. And so it's very individualized. And so the best thing is to try it, which again, we recommend contact lenses as a trial. And so we work with our contact lens colleagues and they can basically fit patients for that. And you know, it's an investment of a little bit more effort and time, but it's worth it before you do something permanent to your eyes.
No, I appreciate these answers. You're doing a great job. We're jumping all over the place here. The next question, I had LASIK eye surgery in 2002 and had great results. However, my night vision isn't as clear as it should be. I've since gotten glasses with a very low prescription and my vision is much clearer with them. So my question is, would I need to get LASIK again to correct for my night vision, or is this even correctable?
So based on that information, I would recommend that person be evaluated. It's too hard to know based on that information what the best treatment would be for that patient. But it sounds like if they do have a small need for glasses, and that in treatment with glasses improves their night vision, they may benefit from a small treatment, which can occur in many cases if it's safe. But again, an evaluation would be necessary to know for sure. Again, if the patient had surgery that long ago, there can be a slight drift of prescription over time, especially to small amounts in some patients. And so that may be why they've had to have a small need for glasses at this point, which certainly can give night vision symptoms if it's untreated, if you don't have the glasses prescription.
Sure, sure. The next question is about doing both eyes at the same time. Is it possible to do both eyes at the same time? And how long is the recovery process?
Maybe we can ask Andrea about it.
I got both eyes done at the same time and told me, go home, get some rest. You obviously want to let your eyes heal. And I want to say, I think by the next day you have to wear these protective like shielders over your eyes. Just make sure you don't hit it in your sleep or anything. And the next day I remember kind of like lifting up one just to like, I could see, and it was crazy. I thought it was awesome. And then after that, it was mostly just be careful of your eyes. Don't rub them. Don't do anything. But the recovery time was super, super fast.
That must have been so exciting, though.
It was awesome. Yeah, yeah, it was really cool to just wake up and see how you're meant to see. You know, not reach for your glasses or put your contacts in, just to see.
Did you have a high prescription?
I didn't have anything too high, but I think I got so used to my contacts and my glasses, then taking it off, you know, seeing clear and then taking them off. To me, it seemed completely dramatic how poor my vision was, but I don't think I had a terrible, terrible prescription.
I think we secretly get just as excited as the patients do on their follow-ups to see how they are.
Oh, I'm sure. I'm sure.
We do. It's very exciting. It never gets old to see patients really happy with their outcomes.
Yeah, absolutely.
I do want to emphasize, Ed, that that LASIK recovery, the question was asked
Sure.
about recovery or healing time, is quite different between LASIK and the PRK surgery, which we could get into if you think it's a good idea. But they're different surgeries in terms of the recovery largely. The outcomes are usually very much the same, but the recovery for PRK surgery is different. It takes longer, and there's definitely can be some pain and discomfort after PRK.
Thank you. I think that's an important clarification there. We're going to move on to PRK. Can you offer advice about choosing between LASIK and PRK? What's the difference in the vision correcting procedures?
So just simply, to answer your question, the difference is sort of how we reshape the cornea, where we sort of put the treatment. Mm-hmm. So with LASIK, which is what most people think of when they think of refractive surgery, we use a laser to make a flap in the cornea. We then actually can lift up the flap and reshape the cornea with a different laser, and then we put the flap back down. And the benefit of that is the eye doesn't really know a whole lot's going on, believe it or not, even though a flap has been cut. When it's laid down, the eye actually recovers very quickly. Typically within just a couple of days, the vision is markedly improved. With PRK, we actually remove the surface layer of cells. We loosen them typically with an alcohol solution, or we kind of can brush them away. And then we treat directly on the corneal surface with the reshaping laser. Now, it's the same reshaping laser as LASIK. It's just that we're putting it directly on the cornea surface as opposed to sort of hiding it under a flap. And the recovery of PRK is quite different because the eye has to heal the surface layer of cells. We're basically causing a big corneal scratch, which at the time of the procedure, patients will be numb. They do just fine during the procedure, but afterwards, that's when it can be slightly painful. Now, in terms of the choice, that's going to be a largely individualized thing. Again, with the discussion with the physician, there are some patients who are only candidates for one or the other based on certain properties or characteristics of their eye. Other patients are candidates for either type. And maybe Andrea could answer, were you offered PRK surgery?
I don't think I was.
So you may have only been a candidate for LASIK. There are certain things that happen that we could guide people, help with that decision. And then it's a matter of talking about the potential risks and benefits of each type of surgery.
Great, thank you for that. How long does it take after the laser procedure before your vision is as good as it's going to get? You may have touched on this. I understand that there will be immediate improvement, but does this continue to improve over several weeks, or is my vision going to remain stable right from the start?
Well, I think as far as a couple side effects like halos and stuff, I think my vision immediately after was great. For about a month, I had some halos, mostly at night with street lights and whatnot, and that completely improved, and I don't have that issue anymore.
Yeah, that's basically what we tell patients with LASIK. We're just talking about LASIK recovery. Is that a lot of vision is improved the next day, and the quality of the vision is what I tell patients will improve for several weeks, even up to a month or two after LASIK, and that's what Andrea was referring to with like the halos that some people will see around lights that will almost largely go away from most patients within about a month or so.
Great. The next question, if after having the surgery your vision is either overcorrected or undercorrected, can you have it done again to fix it, and how soon after?
Yeah, good question. So the simple answer is yes, but the complex answer is it depends a lot on the patient's situation. Again, it depends on sort of how large the treatment was, what the prescription was at the first treatment, and how close they are to their zero prescription need. But we can do enhancements or touch-up procedures if needed, if we think it's a safe procedure for the patient. Now, typically the soonest we will do that is 3 months. We want to make sure things are stable for at least 3 months before we would offer that, because things can change depending on whether it's LASIK or PRK surgery. So we want to see stability with that need for glasses before we would even consider an enhancement procedure.
The next question that we have is for you, Andrea. What did you experience during your process or recovery that you found surprising or perhaps weren't expecting?
I guess I wasn't expecting. I personally experienced a little pressure during the procedure because I believe, you have to stabilize the eye so it doesn't move around. And it was a little more pressure than I had expected from other people. Everyone's different.
Sure.
Other people go in and are completely fine and have a pain-free experience. And mine wasn't painful. I just wasn't expecting that to happen. That was a little surprising. And I was also surprised by how quick it was, honestly.
Yeah, I was going to say, you mentioned earlier your dad was, probably just settling in for the long haul, and then you came straight out.
Yeah.
Okay.
Mm-hmm. Super fast. And then also how quickly I could see. I mean, you're supposed to go home, rest, which I did, definitely. But, of course, you want to test out your new eyes. So that was pretty cool.
Must have been. Mm-hmm. Must have been. Are annual eye exams necessary after LASIK?
Yeah, that's a good question. So it depends on the age of the patient. So a young patient that has no other eye disease, who gets a great outcome after LASIK, then I typically just recommend every 3 to 5 years to get an eye check. Once you don't have a need for glasses anymore, you'll notice if your vision changes, and you could always be seen if that's the case. So really, those eye exams, those annual exams are not needed. Basically, we're just have an eye doctor basically just checking for any eye diseases that you wouldn't have symptoms of. And usually for a young person with healthy eyes, every 3 to 5 years, I think is sufficient for that. Now, older patients, because we can do LASIK on older patients, they may need to still have annual exams if they have any other eye diseases unrelated to those.
Sure. And let's move on to a financing question. What's the cost of the procedure, and are there available discounts or financing?
You want to defer me to that to me? There is a financing option through U of M Credit Union. We let patients know that we, as Kellogg, don't have any say on who qualifies for that. The U of M Credit Union has their own link on our website that we have patients go through, and it's typically, from what patients have told us, a quick turnaround. They said they know more in like 24 hours whether they qualify for that financing. There are discounts available if you're a U of M student, if you're a U of M employee, if you or your significant other or spouse, if they carry you on their insurance and they're an employee, they can also get that discount. And U of M employees can actually payroll deduct for up to 2 years.
Okay.
So we do tell everybody that when they call in. And because we are a teaching institution, we do have the ability to have resident or fellow do surgery staffed by one of the faculty members for a discounted cost. And we let patients know that it's our third-year resident, and then we have fellows.
Great. That's a good answer. Thank you for that. Next question, similar topic. There can be such a difference in costs. Can you explain the wild cost variations in pricing that you see in TV, that you hear on radio ads?
Yeah, I think some of that is just a promotional sort of get people in the door sort of pricing in many situations.
Sure.
Like we've had patients that get multiple evaluations at different practices, and it almost ends up being very much the same for all practices when you get down to the actual cost that patients are asked to pay for their procedure. We don't offer any sales. We don't offer any discounts for low prescriptions because what we have to do is the same. The cost of using the laser is the same, and so our cost is the same for all prescriptions, whether it be low or high. Other places that you may see advertised, sometimes they'll offer very low costs for very low prescriptions that are treated. I think maybe that's part of what they do to get people in the door. But we have the same cost for all patients for any prescription.
Great.
And our LASIK is a little more expensive than the Surface PRK or LASIK because they use 2 different lasers. One laser will create the flap, and then the second laser will reshape.
Thank you for that too. And then I'd like to hear you speak on the difference between going to a place like Kellogg versus a more retail type of outlet that perhaps you might hear advertised on TV or radio.
Yeah, well, I can just tell you that part of what we offer is you meet the physician the day you come in for your evaluation, and we'll spend as much time as necessary with the patients, answering all questions, making sure that expectations are clear for the surgery and the surgery outcome. And so I think that's part of what we offer. And then you see the same surgeon throughout the whole process for all your post-op visits. So I think that's really what we offer. We're also, as an academic institution, very into publishing our results and looking into our outcomes. And so we're also quite conservative, I would say, in terms of what we offer. We're not going to push surgery on anybody. We're really going to offer it to people that we think will get a good outcome because we have a vested interest in people doing well.
Absolutely, that's the bottom line there, really. So we're rolling towards the end of our questions, and I always like to ask, do you think there's anything that I've missed? Are there any questions that perhaps you think I've missed, haven't asked?
Well, I would just emphasize that LASIK can be a great procedure, refractive surgery, for the right patient. And I think a lot of that needs to be determined with an individual evaluation. So I think it's hard to tell anybody that they are or not a candidate based on some brief information. So I would say that if people are interested, the best thing is to sit down with the surgeon and talk out their specific situation, what their goals are, and whether they can be reached. And I think that's the best way to sort of approach this if people have interest in refractive surgery.
When I'm with a patient that's in for their evaluation, when I'm wrapping up my portion, I will tell them that one of the many things about working at Kellogg, but I work with all of our cornea specialists, is they're very, very ethical. If there's anything that they see that they're not comfortable with, they will tell the patients, "I'm sorry, I just don't feel you're a candidate." They're very ethical, which is, I find, very heartwarming for our patients.
Absolutely. Andrea, moving on to you, what are the key takeaways that you'd like someone who perhaps is watching this, what would you like to say to them about your experience overall?
That if you're considering getting LASIK, to go in and get an evaluation, because it is definitely worth it. Not a day goes by where I wouldn't do the procedure over again if given the choice. I'm so happy with the results. And yeah, if you're ever considering it and are tired of your glasses and contacts like I was, it was a great solution for me.
Excellent. And then how about you two? What would you say the key takeaways, if someone's just unfortunately tuned in as we're wrapping this up, what would you say the key takeaways are? I know Dr. Hood, you mentioned that, perhaps you definitely want to sit down for a consultation, everybody's eyes are different and things like that, but is there anything else?
No, I would just emphasize that again. I think it's worth getting a consultation if you have any additional questions, because that's when we can really spend time answering specific concerns or questions that patients have.
I agree.
Great, fantastic. So that's the close of this chat. This chat will be available on Facebook, and we'll also be loading it up to YouTube as well. And any questions on there beyond the live factor will also be moderated and we'll be sending to you guys. So thank you, all of you, for sharing your time, sharing your expertise, sharing your experiences with us today. And have a wonderful morning and afternoon.